VYEPTI is a monoclonal antibody specifically designed for the fast recognition of and high affinity for the calcitonin gene-related peptide, or CGRP. VYEPTI targets and forms stable binding complexes with CGRP. VYEPTI is the first and only anti-CGRP specifically designed for intravenous infusion. IV administration results in 100% systemic bioavailability, allowing VYEPTI to achieve maximum therapeutic concentration post-infusion. Pseudo-unipolar trigeminal neurons are the unique anatomical foundation for peripheral initiation of migraine and its central signaling. Trigeminal afferents become increasingly sensitized by the release of CGRP, initiating a cascade of events, leading ultimately to migraine. CGRP activates local vasculature and recruitment of adjacent nerve terminals. Stimulation of A-delta terminals by C fibers that release CGRP leads to cross-neuronal excitation and expansion of nociceptive fields. Peripheral initiation of migraine nociception drives the relentless activation of sensitized thalamic and cortical relay neurons. Upon CGRP's release, VYEPTI's high-affinity, deep-binding pockets engulf and effectively disable the portion of CGRP that activates the CGRP receptor, preventing activation of downstream biological activity. The relationship between the pharmacodynamic activity and effects of eptinezumab JJMR is unknown. VYEPTI, with its strong affinity for CGRP, traps CGRP, resulting in sustained inactivation. Its molecular design supports quarterly dosing, with no titration or dose adjustment required, based on patient demographics. VYEPTI is the first and only intravenous anti-CGRP designed for migraine prevention. Indication: VYEPTI is indicated for the preventive treatment of migraine in adults. Important safety information. Contraindications: VYEPTI is contraindicated in patients with serious hypersensitivity to eptinezumab JJMR or to any of the excipients. Reactions have included anaphylaxis and angioedema. Warnings and precautions. Hypersensitivity reactions. Hypersensitivity reactions, including angioedema, urticaria, facial flushing, and rash, have occurred with VYEPTI in clinical trials. Most hypersensitivity reactions occurred during infusion and were not serious, but often led to discontinuation or required treatment. Serious hypersensitivity reactions may occur. Cases of anaphylaxis have been reported in the post-marketing setting. If a hypersensitivity reaction occurs, consider discontinuing VYEPTI and institute appropriate therapy. Adverse reactions. The most common adverse reactions, greater than or equal to 2% and at least 2% or greater than placebo in the clinical trials for the preventive treatment of migraine, were nasopharyngitis and hypersensitivity. For more information, please see the prescribing information and patient information, or go to VYEPTIHCP.com.